Welcome to another episode of the PD Exchange, the Peritoneal Dialysis podcast. I'm your host, Dr. Nikhil Shah, a nephrologist at University of Alberta, Edmonton, Canada, and with me, as always, is Dr. Jeff Perl, a nephrologist at St. Michael's Hospital, Toronto, Canada. He's also the editor-in-chief of the journal Peritoneal Dialysis International. Today's special episode is the second part of a series where we are celebrating the women in peritoneal dialysis. On the occasion of International Women's Day, we are joined by three extraordinary women in peritoneal dialysis. Dr. Anabela Guedes from Portugal, Dr. Yeoung Jee Cho from Australia, and Dr. Anne-Claire Nadeau-Fredette from Canada. Please welcome them.
So hello, everybody, to our viewers. I'm Jeff Perl, and this is the second PD podcast celebrating women in nephrology. The first one we released on the International Day of Science and Women, so please have a listen to that. But today, we're going to be speaking to a different generation of PD nephrologists who are going to tell us about their stories, their challenges, some advice to you all, and really, hopefully, in the next half hour, tell us a little bit about what it is to be a woman in nephrology, the good, the bad, and maybe the ugly. With me today, we have Anabela Guedes from Faro, Portugal. We have Yeoung Jee Cho from Brisbane, Australia. And we have Anne-Claire from Montreal, Quebec, close to my backyard, but more snow. And so maybe we'll go around and everybody, you can just say a little bit about yourself. So we'll start with you, Anabela.
Oh, hello, everybody. Thank you so much for the invitation. So I'm a Portuguese nephrologist, and I work in the south part of Portugal. I've been working both in clinical nephrology, and I've been collaborating with ISPD and EuroPD group. So that's mainly the stuff for me.
Thanks for joining us. And Yeoung Jee?
Thank you.
Hi, everyone. Thanks for having me. I'm a nephrologist. I'm based in Brisbane in Australia. And I have been working in PD research and clinical for last over 10 years since I finished my PhD. And that has really opened the window for being engaged with various entities. And I work closely with the ISPD as a council member, as an editor on PDI, and currently a co-deputy chair of the Australasian Kidney Transport Network, where I am trying to lead various PD research.
Thank you. And Anne-Claire.
Hi, I'm Anne-Claire. I'm a nephrologist from Montreal. So I've been working for almost 10 years also. I met Yeoungjee when I did a year of fellowship in Brisbane. I also spent a year in Toronto just before. And I'm doing clinical research, so about 50% of time research and a clinical task. I guess because today is talking about life and not only medicine, I also have 4 kids, which also define some part of my life. So happy to be here today.
So maybe I'll start off with you, and I'll ask the same question to all of you. Nephrology is pretty vast right now, and there's more areas of subspecialty than ever. Anabela, what got you interested in PD? How did you decide you were going to do nephrology? And within nephrology, how did you decide it was going to be about PD and home dialysis?
That's a great question. And it's a contrast from the podcast you had earlier with Edwina Brown and Ron Bergman, because they got into PD by a coincidence in their lives. And it was the opposite for me. When I went to medical school, on the 4th year, I already knew I wanted nephrology. And then I came across this teacher that had like a glow in her eyes showing PD-backed solutions. So I already knew
Who was it?
university.
Who was it?
It was Professor Anabela Guedes. That's well
two
known in
Anabelas.
Portugal. Yes, two
Okay.
Anabelas in Portuguese nephrology,
Okay.
that's true.
Okay.
She was just like showing and lifting the bags of PD solutions, and she had this big smile, and she was so happy. And I said, that's what I want. She was talking about PD patients and autonomy and quality of life. And that was what I wanted. So I traveled across the country to go and grab my nephrology vacancies south of Portugal. So I did my residency. We have 5 years of nephrology. I went abroad to study PD to Madrid in Spain. So I was there for 2 months. I also extended my hours, the outpatient clinic, to address PD patients. So I really knew that I wanted. Then when I finished my residency, I was like 1 year working here at my hospital.
Yeah.
And then I was invited to be the leader and to assume the PD unit that was already working. It was a small unit with a lot of space for improvement.
Yeah.
And it is my passion. So since university,
That's wonderful. So you're the director of your program?
yes, for 10 years
And
now.
and how many patients do you have?
When I started, we had 20. Now
Yeah.
we have almost 70.
Oh, that's
And
fantastic.
yes, and all during this career, I did my PhD also, and
Yeah.
I met Edwina Brown. And I never really had a mentor because you talked about it also on the other
Yeah.
podcast.
Yeah.
So I was more like self-trained and self-taught, but
Yeah.
I
Yeah.
always had like role models. So Professor Anabela Rodrigues, Professor Edwina Brown,
Yeah.
and in Madrid.
Yeah.
So all of them female PD doctors. So they were like my role models, and I tried to go after their path and their knowledge. And when we met, she was like, listen, your generation, like the three of us that we are here, like you are PD champions, as she calls us, and you
Yeah.
should join ISPD and you should
Yeah.
work together with us. So I'm an active member now, and here I am.
That's fantastic. That's great. And so for you, it was really somebody who inspired you with the passion about
Yes.
home dialysis and autonomy and all the flexibility of home therapy and seeing that. And that was, she came to your medical school?
She
What,
was Professor Annabella was
yeah,
my teacher at university.
at university. Okay. Wow, that's a really interesting story. What about you, Yeoungjee?
I actually never thought that I would be a nephrologist when I entered medical school.
Yeah.
I did it as a residency, and I really love the fact that your patients never leave you and you take a very holistic view of advocating for your patients and going forward. And I think that's what really attracted me, on top of good medicine that you get to do in the field. I'm a little bit similar and also different from Annabella in the sense that my journey into PD was also inspired by an individual. I think that that individual that was surely David Johnson, who's always been a mentor to me over the years. And if I had to put a second role model who inspired me to do PD, were my patients. Dialysis is very burdensome, and I think patients who go through that journey really inspired me and are wanting me to do something better for them. I think David has provided me with opportunities and skills to be able to deliver on that, but it's probably my patients who drive me to do better and go forward. And along the journey, you meet people who share similar interests. And I think with that, that inspires you and motivates you further. And then more than
Right.
10 years just goes so quickly. And here we are.
So again, a combination of mentorship. And did you get exposure to PD in nephrology early on?
I did. So I think I came across a paper that was published in PDI a few years ago about how
Yeah.
little PD education exposure exists. That was quite a contrary for me because, in fact, first year of my residence, that registrar year, my supervisor was somebody who had a big home dialysis portfolio, and I had to
Yeah.
rewrite their PD curriculum for the unit. And
Right.
then my second year supervisor was David Johnson and David Mudge, who are both identified as key opinion leaders in PD. So coincidentally, I think that our connections have led to inspiration and then a journey forward. And I consider myself quite lucky to have been able to find something that aligns very closely to my motivation.
That's great. And Annie Claire, tell us about your path.
So when I was a resident during my first few years of internal medicine residency, I met some of my former colleagues that were in charge of home hemo and PD. So I'm the home dialysis director for both modalities, but back then there was one PD director and one home hemodialysis director, and they were both very goal-oriented, strong mind, and not everyone would align well with them, but I really like the way that they work and the patient. And I think we had a good connection. So that was in my early years. And then by the time I was PGY 4 and 5, so towards the end of nephrology residency, they identified me as someone that could take over the program, which was quite a big responsibility, but also it really aligned with my, I guess, my own will to be close to patients. I really like the fact that home dialysis patients take care of their treatment themselves. You can really follow them over time. You see the difference that it makes in their life. And even when they get transplanted, they still come back to see you sometimes. They're so pleased to share their experience. So this is something that really, I guess, interested me in home dialysis. And then after that, I went 1 year in Toronto where I met Joanne Bardman, who was a real inspiration and really felt like she was my mother of nephrology. She has a daughter about my age, and I think we always had that strong connection. And I felt so lucky to have her as a mentor in the PD world. And then I went to Brisbane, had the chance to work with David Johnson, who's also been a good mentor, not as much as for Yeoungjee, but still he had a big influence and gave me other opportunities. So I think it's all about being at the good place at the good time and aligning the clinical interest with opportunities that I guess I had. I was very lucky.
And it sounds like the commonality among all the stories is just meeting somebody inspirational, meeting somebody who, in your case, Annie Claire, it almost seemed like you weren't sure what you were going to do, but they, maybe I'm misinterpreting it, but they identified you as somebody who could be a leader. And then that
Yes.
got you interested in home because maybe they
Yeah.
had a need for somebody with home expertise where you were.
Exactly. So they
Right.
wanted me to come back with that expertise, and it
Right.
turned out that it was meant to be good for me.
Everything worked out that way. And Annie Claire, you already alluded to the fact you have 4 children
Yes.
and the ranges of their age.
3 to 11.
Wow.
3, 6.
So balancing a career in nephrology and 4 children. I have 2, and that's a lot. How do you do it? How do you do it? Tell us, what's your secret?
There's no secret.
Is it sleeping 2.5 hours a night?
It's being able to be sleep deprived sometimes. I think the secret is to have a good partner, to share responsibility, to understand that you may not always be there for everything all the time, and accept that things are not always perfect, but they are good in the most ways. And I think for research, sometimes, of course, it's harder with more kids because they don't go to sleep. You don't have any time to work at night because they are always there. During the weekend, we joke with my husband that we have too many kids and this is our problem in life, but we chose that. And at some point, it's like I would never do something that I would regret later. And I think that children will always be the priority, but their needs and my need change over time. And it's good for them to see that their mother is working. We have also our own life. I'm working hard on the grant, and it's difficult. It's not always easy. So this is good learning point for them. And we share a lot of things this way.
Do you feel you've compromised on the time you get to spend with them because of how productive you are?
I wouldn't say I'm that productive, but I do compromise in the fact that I'm not home at 4 p.m. to get them from school, right? I go back home around 6. So this is a difference. And if my goal was to be there very early every day, I would be unhappy. But if you take that apart, when I'm there, I am there. During the weekends, I almost never work because we are together. We take some vacation together. And I don't think children need their parent to be there all the time to feel good. Of course, there's some compromise. I don't have a lot of social activities or time to see friends and go out and stuff like that. But for me, my family and then work and research, they're the priorities.
Yeah, like I have a group of friends that I go out with once every couple or 2 or 3 months, and they're out all the time, and they have kids, and I just don't know how they do it. And the truth is, sometimes by the end of a night, and like on Saturday night, all I want to do is just get the kids to bed and just watch a movie and do nothing. And so I think I see your point. We do compromise maybe a little bit on some of the sort of socializing and whatnot. And your point about less time, but make the time you're there worth it, worth meaningful time. And I like the boundary you create about not working on the weekend. I've crossed over that boundary with very tight deadlines, but I think
I do sometimes.
but I think that's important. I think boundary setting is probably really important to yourself. And I've always said nobody died because I submitted a paper 3 weeks later. You can't, especially for me, when I look at baby pictures of the kids when they were younger and stuff, and I'm like, you can't go back to that. I do that every once in a while just to rejig myself to, okay, got to be here in the moment. And it is a tough compromise. How do you balance things, Yeoungjee? You have 2 children, correct?
I do.
What are their ages, by the way?
They're 10 and 13. So
and we've called you a tiger mom at times.
Tiger mom traits.
Tiger mom traits, right?
And I've clearly crossed the boundary by joining this podcast on a Saturday morning, Australia time. But this is my only commitment for the weekend.
And you've been up since what time, you said?
I've been awake since 3:50 because I had to send my son to rowing this morning. And yes, and then yesterday was also I think 4:30 awake because I had to send my son and my daughter, who was performing for choir at a stadium. So it's been a pretty intense week, but and there are definitely compromises, competing moments, and moments where there are a lot more intense and lax. But I feel very lucky that I am able to work part-time and do research and contribute to and be present for my children and family. I'm definitely guilty, however, that there are moments of when the stress level's high from various demand points that it does bring the probably not so good side of me. I think that my family get to see the best and the worst of me at all times. And I think that I'm very prone to that and aware of that. But equally, I think my family keeps me very grounded, and I think my work gives me a good perspective and understanding of life too. So I think both of those elements complement each other. And I have no doubt that being a mother makes me a better physician, a much more empathetic one, compared to the way that perhaps what I would have considered my life would have been. Prior to children, when you put effort in, you get a result and you feel that it is equating sort of equation. I still remember when I had my first child, he didn't sleep for quite a few months. And no matter how many books I read and try to find different strategies, it just didn't equate. And there are just some things that no matter what you try, it doesn't quite work. And I think that you reveal the most vulnerable side of you in front of your children and the family. And I think that when you go through that, you also see what patients might go through in their lives too, and then try to understand how this all interplays. Because I guess for me, I'm lucky to feel that I have a pretty good health, and competing pressures are things that I choose for myself, whereas many of our patients don't have that choice and have to endure that burden of disease and treatment on top of the life commitments that they have to deliver on. So I think for that, I feel very grateful for the life that I have and to be able to do the job that I love.
No, I think that's really important. Drawing on like the human lived experience and your challenges balancing work, and that sort of gives you a much deeper understanding of what our patients go through, which is a lot of extra work just to stay alive by doing their own dialysis. And I think that perspective is really important. Now, you slipped in there that you worked part-time. Was that by design to balance family and work? Tell us a little bit about your arrangement.
Yeah, so I work in a transplant unit, and before I came on and being appointed, everybody in my unit were full-time physicians. In fact, I loved the people that I work with now, who used to be my bosses when I was a trainee, and I wanted to go and work there, but I never thought that I could, because I would see these people coming into work before the registrars get in and leave after, and that was not the life that I wanted to lead as a mother. But then an offer came where I could potentially job share and do part-time because that's what I wanted. Because as I have my children, I wanted to be there for them. My mother was somebody who was always home, and I have a very close connection with my mother, and I wanted to be present in my children's life during their growth. And for that, I feel very grateful that I could choose to work part-time. And this arrangement is actually really wonderful because I job share. So I have somebody I job share with me, which means a day that I have off is completely off. And I work 2 long days and 2 short days, which means I can do most of the school and extracurricular activities with my children. And try to work on my research on my day off when I'm working from home. But that's a
That sounds
choice that I
wonderful.
make. Yeah.
So who's your sharee?
So she's Carolyn Van Efs. She actually is a clinician researcher herself in home hemodialysis. So
Okay.
we are sort of partners in crime for home dialysis portfolio in our unit.
That's amazing. So did you guys both start together?
No, Carolyn was actually my boss when I
Okay.
was a trainee. She's quite a few years ahead of me. And when she went on maternity leave to have her twins, she wanted to no longer work full time and reached out to me to see whether I would be willing to consider the partnership. And at that point, it was quite a scandal because in our unit, this was not something that anyone ever thought it was possible. And our working hours roster that we proposed was also a little bit different from what the conventional hours are to meet the school drop-off and various times, with the condition that when we are doing clinical load, that we will be present and do extra mile to get things done. We will internally manage. And the unit was very receptive to that. And I feel very grateful for our colleagues who have supported that. And because we have been very successful, we actually have had quite a number of different pairs of the job share arrangement recruitment that have been completed since that day. But I still remember John Burke, who was considered a father of nephrology, and he probably remembers his son, Michael, who used to work with us in our PhD room. And he told me the day before I started, he said, you better not stuff this job share up, because if you do, no one will ever be able to job share again. It will be a huge disadvantage for, people like you who might want to have a career in family. Yeah.
Obviously you haven't, and you've been very successful, and none of us would know that you're job sharing. You definitely are a very heavyweight in the PD world. And so now, is it like a very common practice now to have these job sharing arrangements in Australia or where you are in Brisbane?
In my unit, we are probably almost 50-50 job share and a full-time nephrologist. And that has become a more newer arrangement of people like me at the time. When I started, my child was only my second kid was just born, really, just around that time, Jessica, and she's now 11 in a couple of months. So since that time, there's been about 3 sets of the pairs of the job share arrangement that have been recruited in our unit. I don't believe that this is a very common practice nationwide. I think that it is also important to the job share doesn't come without other sacrifices that come. For example, like we are very mindful that we work as one rather than two, so that during school holidays, for example, which I really believe in taking time off, we'll take 50% of that each and we'll cover each other on the other 50% when the other person's around, so it doesn't actually cause inconvenience to the other members of the unit. So you work around a different arrangement to function as one whilst trying to fulfill the priorities and demands of home and work.
But on a positive note, it's nice to see that it sounds like when we're talking to the senior women in PD a few weeks ago, it sounded like you have to fit the mold of what a nephrologist is. There was no such thing as maternity leave we're talking about, and very much a male-dominated world. It's nice to see that at least there's at least a precedent for reevaluating workflows and positions to be able to accommodate it. Do you think now, to finish on this, do you think that women put themselves at risk for getting a job when they say something like, I really haven't, or I'm about to start a family, or I have a young family, and it's really important for me to have this sort of arrangement? Do you think that is a stigma that exists, and you were just lucky? Or do you think that people should have the confidence to raise these issues and looking for job opportunities? Because I can imagine that it might be if you're looking for a job and looking to get in with a group, it might be off-putting, unfortunately, to many groups. And do you think what would be your advice for somebody in that situation thinking about this type of an arrangement?
Yeah. Look, there's always a risk with everything that we do, okay? But I think that what's really important that you need to believe in yourself is that if you're happy at home, you're likely to be far more productive at work.
Right.
And to be able to achieve that, you need to be realistic about what you can deliver and what you can provide. And I think sometimes we are at the risk of overcommitting and not able to deliver on. And I think that can have its own detrimental impact. So therefore, I think that having that conversation is important and working out what is it that's really important to you in your values going forward. I did not actually apply to have a job at my unit when I was finishing my PhD for the very reason that the workload as a full-time would not be compatible with my vision of life originally. And then this opportunity came out of the blue. But I am somewhat confident that that model has become replicated and supports the younger people who are coming on board with who have these similar dilemmas to be able to reach out. And certainly the pairs that we have hired, one of them is about to go to maternity leave, and it's important. I think it's important that we are humans and we have goals of life that are important to meet above and beyond our role as physicians.
Yeah. I think sometimes though it is you use the word overcommitting. I think most of us are guilty of that. And certainly the more junior you are, the harder it is to say no. And sometimes it's hard to say no to certain people. And I think someone said to me, what's the now that you're more senior, how has your perspective changed? I think I'm a little less nervous to say no and a little bit more confident to say no to some things because you just can't do everything. But it's nice to see that hopefully you'll be a role model for many other people moving forward in their training who could see this as a really viable opportunity for them. So Anabela, tell us, in the beautiful Algarve, Faro area, sounds like vacation all the time for those of us who've seen pictures or been there. How do you manage a busy career and family? Tell us about your family and what have been some of your challenges?
I also have 4 kids.
4?
Yes.
Oh my gosh.
So, yeah.
Wow. What are their ages?
Yeah, 7, 11, 13, and 15 now.
Wow.
So my challenges are a little bit different now. When I need to study, I just join them all in the living room and we study all together. So it's a different routine. So it will get better. Believe me, it will get better.
Yeah.
But I know, I think it's like PD is calm and soft. Also, me and my kids, we try to manage smoothly throughout the days and weeks. I work during weekends, unfortunately, but I managed to get them to school every day and pick them up every day. And as you were all saying, when I'm with them, I'm really with them. So I try not to have mobile phones or TV on, and dinner time is precious. So we stick to talking in family throughout dinner. And so that's what I treasure. And I manage to do everything. On the other hand, I have 2 daughters and two sons. Mainly the daughters, they look up to me. Every time I tell them I was invited to this or I was invited to that, and I will talk in public about something that I'm working on, they feel really proud about it. And sometimes I ask for their cooperation because I need to do, I don't know, a course or I have a struggle, and they really unite and they say, look, mommy has to work now. Let's help her. Or let's, I don't know, do the dishes and all of that stuff that normal family life has, all those challenges. And they really try to help and collaborate. So that's, I don't know, a great family union and feeling that we go through all difficulties together and we have priorities. So this week, my eldest daughter came to the living room and she said, my teacher is talking about nephrology and talking about urinary function and everything. She does not know what PD is. And I was just, my daughter knows what PD is. And I told her, please go and explain to your teacher and to your colleagues. So they really, I don't know, we live a little bit of this all together. Their victories and my victories, and we do it as a family. So they are a
But
little
what are
bit
the
used to it.
challenges? What are the challenges? It can't be all roses all the time.
No, there are a lot of challenges. Of course, there are. Of course, they are not perfect. I'm not perfect, and I don't have time for everything. And there are too many for one mom. So sometimes activities they get on the same schedule, and it's not. And then I have to explain why I prefer. It's not a preferential, but I have to go to see football game of one kid and not the other kids. And
Right.
but we manage.
Do you
Like
ever get
PD, it
stressed
flows.
do you ever get stressed at work? How do you feel pulled to work and being away from family? Are you do you do equal work to the
I have a different scenario
yeah,
from,
so tell us about your
I
scenario.
guess that I have a different scenario from everyone in the room because we do private setting and public setting. So I have like 3 jobs. So it
Okay.
gets a little bit worse.
Yes.
Yes, but we accommodate everything. And I do
Okay.
not have family support, as I told in the beginning. I came to the south part of Portugal moving towards nephrology and PD units. And yes, it is rough sometimes,
So
but
you don't have family support, you said. No
no.
parents
And
around.
it's not feasible to pay a nanny like Edwina and John Barkman did and Ana Figueiredo. So it's not feasible. At least nowadays, it's not feasible.
And your partner?
He is also a doctor, but he's older, so has different goals and challenges in life. So it helps a little bit to accommodate these difficulties.
So you sound like super mom, really.
Like Ankla said, I don't go out to see a movie. I don't go out to see my friends. I don't have hobbies. I don't do gymnastics. So yes, I
We
try
are
to
so
do
boring.
Right. No yoga classes.
No yoga classes, so I
Right.
just put my fingers and breathe. But I do that
Right.
in my PD unit. My patients laugh with me when I just breathe in and breathe out to accommodate any stress. But no, I do not have yoga classes. I do it
Right.
during PD and attending patients. Yes, I just breathe in and breathe out a
Okay.
lot throughout the
Okay.
day,
So
and then
some
really
personal time is definitely on the
off,
short for you.
off.
Yeah.
There's
You're
no
not
personal
going
time.
okay.
No,
So
it will
something, yeah.
be next year
Yeah.
or in 2 years' time. I believe
Yeah.
that someday it will come.
Because as they say in English, there's an expression that something's got to give, right? Let me ask you all, have you experienced sexism in the workplace or in your job? Maybe I'll start with you, Anabela. Like as a woman in PD and in nephrology, give me an example where you've experienced that. And what would whether it was overt or subtext?
It's never overt, never. Okay. So it could be just a sensation, but during my residency years and the first years in the PD unit, I felt like procedures and interventional nephrology was not a female path. It was more difficult for a female doctor to be taught how to insert a catheter or something like that.
Yeah.
But I just went by it and you just pursue it. And finally, my mentor in catheter placement was a man.
Yeah.
And I guess he was driven by exhaustion and he finally let me do it. And so now I'm very grateful for his teachings. But I guess in the beginning it was like, this should be something for someone else.
Oh, that's interesting. That's a good
Yeah.
example. Yeah, and it
Yeah.
sounds like you had a lot of, again, there's another expression called mansplaining.
Mm.
It sounded like there was a lot of that going on, if I can
It
understand.
could be just a sensation.
Yeah,
But definitely you want to learn and you want to do it, and you feel like you're always stuck in the same place, and then you just think, is it
right.
because of that?
And what about you, Annie Claire? Did you ever experience it?
Probably, but I have to say, I never felt that. I feel we are lucky to be nephrologist, woman, and researcher in 2025, and that we have a lot of opportunities. So throughout my life, I always felt that I was lucky to be where I was and where I am now. That being said, I think there are some gender bias that may be positive or negative. I think my previous supervisor in my own center thought that I would do good for PD and hemodialysis because I was good with patient, I was listening, I was kind, and all these kind of feminine characteristics that maybe they didn't consider me for basic lab science research. It also went well with me and
Hey,
it fits my
you may have
interest.
dodged a bullet there.
But maybe, but this is something that I think is there, but it's it's not really sexism. It's mostly some slight difference, but I feel that we've moved so much forward in the last 20, 30 years that I would always consider myself very lucky to be doing what I do now. So I don't know. It's getting much better.
Yeah, and hopefully all of you in the positions you are hopefully trying to police that a little bit and make sure that things are improving. What about you, Yeoungjee? Have you ever experienced any sort of conflict or issue at work over this?
Probably not overtly. And maybe something may have happened with that, but not enough to probably recall. I think the gender equity and these issues have become quite, I say, quite forefront over the last decade or so. And when I reflect on it, for me personally, I feel that some of the opportunities that I didn't get to at a stage that was my own doing, just because I had competing pressures and things that I wanted to deliver at home. And I guess even though my partner is very supportive, I guess I do play majority of the home related responsibilities. I think with the COVID and changing the whole space of the virtual meetings and commitment, things have moved even further in providing opportunities for women, I think, like myself, who choose not to always travel a lot,
Yeah.
to be able to connect and partake in various roles. I think a decade ago, before when these were not as prominent, I think that it was even bigger gap. It's probably just my personal observation.
Yeah, so that's interesting. So the virtual world we're living in more because of COVID has probably allowed us to be a little bit more balanced in terms of family and work life. And it's true. I have to say that during COVID, maybe all of you guys can comment. During COVID, it was forced to be with your family and have that family time. I probably would have traveled a lot more during COVID and not had as much time with my family during what are either younger years when my children are 9. I have 2 9-year-old twins. Yeah, that's a really good point. I'm going to ask you two final questions to you guys. The first question I'm going to go around and ask, is there anything you would have done differently, or knowing what you know now, Anabela, about your path? Anything you would have done differently, or now that
I don't really know. I think probably I would go to ISPD earlier. I guess I was, I don't know, the unknown and feeling small because it's a smaller country in that it's not a central hospital. I would aim for the stars a little bit earlier.
Yeah.
Perhaps that.
Get out there, meet people,
Yes.
get involved earlier. And I
Anyways,
think Yeah.
My children were younger, so probably I wouldn't be allowed to do it. So
Right.
probably I'm on the right path.
Annie Claire, anything looking back you might do differently, or you might?
Maybe worry less.
Yeah.
I feel when you are stuck in a moment, either your kid is not sleeping or your paper is rejected, or there are so many things that happens. And through the years, I've learned that it's going to be okay. And sometimes it's difficult and it may not work out exactly how I wanted, but there will be other opportunities and and things will come later and the path will go ahead, whatever happens. So I think this is something that I wish I have learned earlier, but then you also need to learn it probably. This would be an advice too, and also to never don't get into despair. So over the years I had, when I came back as a staff, I had two young kids. My second child was never sleeping, but whenever I was so tired, I was working full-time clinic at that point because I was just back in my hospital. I almost gave up research, and I think I had support from my colleagues and everything, and it turned out okay. But I wish someone was there with me along that way to say, like, it's okay, don't let go, but also don't worry so much.
So to everybody out there who is worried that their paper got rejected, or they didn't get asked to go to this place, or they didn't get the grant, it is all going to work out. And it's just one obstacle, and we've all experienced it. And maybe you can just learn from that. I think things do have a way of working themselves out. That's really good advice, Annie Claire. And I can tell you that I definitely had worried and angsted about things that now don't pass the what does this mean for me in 10 years? You got to ask yourself with every challenge and every conflict, what is this really going to mean for me in 10 years from now? And I've been guilty to overfocus on things that probably are minor too. Yeoungjee, what about you?
I share. I think I share what Annie Claire has said. Definitely, I'm very guilty of that. And you're right. When you look back, it doesn't mean much, and I think if I don't have any regrets, and I feel very fortunate to have met people who have supported and inspired me along the way. And many of you are even online today. And I think that I wouldn't change it any other way.
Yeah.
What I did, I think probably the most important thing that happened to me was having a mentor who could see about my future before I could see it. I think when you're an early career of your journey, like I was just so focused on the immediacy of what I had to do. And I didn't really see that there are some things that number one, it will be okay. Number two, that making these connections and doing things is actually helpful for your career going forward. And you don't even know where you're going. And I think having somebody there to reassure you and guide you is really important. And I really hope that one day I can be that person for others along the journey, because I guess part of the reason why internal medicine attracted me was that the mentorship and the guidance and the community of together was one of the big part of it. And I hope that doesn't get lost and we grow in that space and we can play an important role in that.
Yeah. And then I think that's all really sound advice. And just, one thing just to ask, maybe anybody, this one's up for grabs from all of you. We in nephrology, we have really sick patients, right? Like everybody in the hospital says, you guys have the sickest patients. And our patients have multi-morbidity, have many issues, lots of transitions, Annie Claire, across different spectrums of kidney disease with all those challenges. And for somebody who wants to focus on a family, maybe this isn't the right specialty for you. And maybe there's other more lifestyle conducive specialties, as people put it. Any counter to that? No, that's true. What do you guys think about people who say that about nephrology? And
as challenge, so I might go first. As challenging as it is, so rewarding. And you're right in the sense that you don't always succeed. You don't always get what you desired outcome, but you work in such partnership and advocacy and trying to go through that journey together with patients. And I don't think many specialties offer that kind of experience, particularly the ones of the lesser intensity.
Right.
And equally, you do this for a very long time of your life. I think it's really important you do something that resonates with your heart and your thinking and your belief. And that sounds perhaps very non-scientific, but I think it's really important that you have compatibility with your personality and your work ethos and your grounds with the specialty you choose. And definitely that shouldn't be a deterrent to choosing this.
I think that's really a very important point about, I can agree with you. The whole experience about we develop these connections with our patients over time during very difficult parts of their lives. And you're right. I think that those connections are really very inspiring. And like you said before, influence how you approach your own family and your own challenges. And I get a lot of inspiration from my patients. So I think that's really well said.
I do agree. I think so. You choose your specialty because this is how you see yourself, because you want to be there, you want to grow in that work. And yes, sometimes it's more difficult, but in the end, if you're happy to spend your day with your patient, with your colleagues, you will be a better person. And I think I'm a better nephrologist because I'm a mother, and I think I'm a better mother because I'm a nephrologist. So it really goes both ways, like you said.
That's such a
And I
nice
have some
thing.
friends. Yeah, I have friends that have other specialty. It may be seem less time consuming. They don't do rounds at night for dialysis, but that this is not what I wanted to be and wanted to do. And in the end, it's the only thing that is important, I think.
Yeah.
I think this specialty is for a giver. You have to be a giver, to embrace your patient and the journey of your patient.
Yeah.
I think it has everything to do with what Annie-Claire said and Yeoung Jee said. It's so rewarding, and it works both ways. In the hospital and at home, it works both ways.
Yeah. And I think that's a great place to end. And I think that you guys have provided some really unique perspectives on this generation of women in PD and in nephrology. I'm sure you're all role models for so many people yourselves. I guess you guys just maybe don't see it at this stage yet, but I think you guys are just very impactful to the PD community. And thanks for sharing your stories and your insights. I know that I learned a lot and really was inspired by everything you guys had to say. And Nikhil and I were talking about this, and maybe there should be a follow-up editorial in PDI that should happen after this. But I said, you know what? If I ask Anabela to write it, I'd rather she go to a movie instead. Just listen to the podcast.
No, I will put my kids with me and we'll write it together. That's okay.
Anyway, so thank you guys all for your time today.
Sorry, folks, I
Thank
wasn't
you.
around, but thank you so much for
That
making this
was
happen.
great. I think that was great.